what I'm hoping you can see now is the presentation. Does everybody see that?
Yes.
Good, excellent. So I'll make this available to anybody who wants the slides, but if I just run through a few slides to start with and to talk about the research that's available at the moment, then we can see whether and how that could be applied. So just to give the background, if you look at the WHO guidance for control of COVID-19 in the food industry, they're very clear that there's absolutely no evidence that COVID-19 is spread through food or through packaging. It is possible to identify the viral particles from fecal material of positive cases, but similarly, there's no evidence of fecal oral transmission. So what the WHO says, in agreement with all the other researchers, is that the main spread for COVID-19 is person to person via droplets. There is also the possibility of spread through contaminated surfaces, through fomites. And in the food industry, this would be surfaces and equipment, or any other objects that might have been contaminated by an infected person. And that infection can happen by infected hands touching things, or, by the usual routes through sneezing, coughing, spitting, shouting, singing, whatever. So although it's quite clear that COVID-19 doesn't spread in what we would typically think of as the fecal oral route through food, as in normal food poisoning, there have been a very large number of very large outbreaks in the food industry, and they've typically been focused in slaughterhouses and meat processors, with a small but very significant showing in seafood markets and seafood processors. And there have been well-documented cases in Europe, West Germany and Portugal. Here in the UK, we've had at least 4 big outbreaks that I know of. Also in Australia, and the outbreaks that are recorded in Ghana, those were seafood processors rather than meat processors. But one of the things that is quite clear from looking at the literature associated with these outbreak investigations is that these outbreaks have really high infection rates. So for example, in Germany, in the German outbreak, there were 1,500 staff that tested positive. And in Portugal, again, nearly half of the staff were testing positive. The outbreaks in the UK are quite similar. And one of the things that I noticed when I was looking at this data was that the outbreaks that we've had in the UK, which are in meat processing, in slaughterhouses and poultry cutting plants, they have been in areas where we have a very high incidence in the community. Merthyr Tydfil, for example, is in the South Wales valleys, and it's got the highest incidence of COVID-19 in the entire country. And so what seems to be happening is that a person will be infected in the normal way from contact with their family or in the community. And simply by going to work in the meat processing industry, they are actually creating the super shedder event, because the factories that they're working in actually enhance the spread of the virus. And some data that came out of the USA, the CDC were doing some surveillance. And in a single week in April, they looked at 115 meat plants, and they found nearly 5,000 cases, and that equated to 3% of all the workers. So what that's sort of saying is that there's a sort of steady stream of infected people going into the meat industry. And once they get in there, the meat premises, the slaughterhouses and the cutting plants and the meat processing plants actually act to enhance the spread of the virus. And the research suggests that there are a number of very important reasons for that. In most of the meat premises, slaughterhouses and meat processing plants I've been into, the workers are in very close proximity. So people are working at their workstations, but they're actually quite close to other people. And there's a lot of talking and laughing and discussing. It's not a quiet environment. So if somebody's infected and they sneeze or they cough or they're just talking, to their colleagues, there's a great potential for them to spread the virus. There's also a lot of movement around the premises, and research that's been done in China, both in seafood markets and in hospitals, have demonstrated quite clearly how easily the virus can be distributed in the environment just by people walking around. They have evidence of distribution on shoes, which walk around then the premises, people's hands, people's equipment, all the usual ways that you would spread infection. And these applicable in the meat industry as well. I think one of the things that's really striking about the meat industry is about the environment, how noisy most food businesses are, most slaughterhouses and meat premises. I've never been in a slaughterhouse or a meat processing plant where I didn't have to shout to make myself heard. There's a lot of noise, background noise. It's certainly in the ones in the UK, all the slaughterhouses have usually got a radio somewhere going full blast, going through the loudspeaker system. And so people are naturally speaking very loudly and shouting. And the more you shout, the louder you shout, the more that enhances the aerosol and the spread of the virus. Another thing about the environment in the meat premises is they tend to have quite high relative humidity. And that, of course, enhances the survival and the spread of the virus. In Pakistan, I think you've got an advantage over us in Europe, because in Europe, Australia and America, all the meat premises, the slaughterhouses and the processing plants are very cold. And of course, cold temperatures enhance the survival of the virus. Now, that may not be applicable in Pakistan, and that's a good thing. And the final thing that enhances the survival and spread of the virus that you find characteristically in meat premises are a lot of metal surfaces, a lot of metal and a lot of plastic. And such research has been done on the survival of the virus, demonstrates that stainless steel is one of the best surfaces for the virus to survive. If you look at the publications, you can see that the virus has been demonstrated to survive on stainless steel surfaces for up to 4 days, and also plastic. Whereas if you look at copper, which we know is a good antimicrobial surface, if you compare that to copper, it doesn't survive 8 hours on copper. But on stainless steel, it can still be hanging around for several days if somebody sneezes or contaminates the surface. One of the reasons that we don't think that food packaging is a good source of the virus is because it doesn't survive on paper or card for very long. However, it does survive on plastic for a long time. So plastic wrap is also a potential surface for the virus to survive. The aerosols, which are the main way that the virus spreads, the survival of the virus in aerosols depends very much on temperature, ventilation, and relative humidity. The research that's been done demonstrates that at about 23 degrees C, which in the UK would be ambient temperature, you get virus survival for up to 16 hours, especially if the relative humidity is quite high. And although most guidance documents suggest that if you stay 2 meters apart from people, 1.5 to 2 meters apart, that's a safe distance, there's also ample evidence to suggest that a good loud shout or singing or very good projection of the voice can actually spread the virus up to 8 meters. And this is enhanced, the sneezes is enhanced by shouting and singing. And there was an outbreak in the UK, which is very good information demonstrating how well you can infect somebody just by raising your voice. This was an outbreak which was focused on a choir, and there was one infected singer who went into the room. They were practicing for 2 hours. They were all facing front, so they weren't actually facing each other. They were all facing the conductor. And this one infected singer in 2 hours managed to infect nearly 90% of his colleagues. So to me, that's a really good demonstration of how raising your voice, shouting, I guess lecturing as well. We've had to be really careful when we were teaching at the university. All of those sorts of things that you find in the meat industry, the shouting in particular, can actually enhance the aerosol and the spread of the virus. So what are the controls? When you look in the literature at the controls, the primary control is always to stop infection getting into the premises. And that means that the food businesses need to start screening. They need to screen their staff. And the advice that's in the literature is pretty standard. It's what we all know, that anybody who turns up with respiratory symptoms should be prohibited from working, and that person should be isolated and quarantined according to the national guidelines. Here in the UK, that's 14 days. And the contacts must also isolate. Now, those food businesses that I mentioned to you at the beginning in the UK, where we had these big COVID outbreaks, those premises had to close, and they were closed for 14 days. And the staff were not allowed back until they'd been tested. And the staff had to demonstrate 2 negative tests, 48 hours apart, or they had to stay off work until 14 days after the symptoms stop. So getting an outbreak in a food business is a major problem for the food businesses. It's not just the person who's positive that has to isolate, it's all the contacts as well. And also staff with illness in the family should be prohibited from working. And asked to isolate for 14 days. Now, that's very standard advice. That's what we all know. It's on all of the documents. It's on all of the guidance that comes out. But this actually only works to control symptomatic patients, people who've got respiratory symptoms or who test positive. And what we also know from the literature is that asymptomatic and pre-symptomatic carriers can also spread the virus. And there's some suggestion in the literature that people are actually at their most infectious when they're pre-symptomatic, just before the symptoms develop. So they're feeling fine, they're not demonstrating any symptoms, they come to work and they're actually shedding huge amounts of viruses. And however good your screening process is in the factory or the slaughterhouse, it's unlikely to identify these people. And so there needs to be a second line of control. And that second line of control relies on good hygiene practice in the premises. And those good hygiene practices can be divided up into practices for people and practices for premises and equipment. One of the really good ways that the industry has found about controlling the spread by asymptomatic or pre-symptomatic people is by limiting the number of people who are actually on the premises. The fewer people you have on the premises, the less likely you're going to have one of them asymptomatic or pre-symptomatic. And so many of the premises are limiting visitors, not allowing people with who would normally come and inspect or look at the premises, or customers, limiting how they can get onto the premises, limiting, if they have to come, limiting how they get to the premises, how many of them there are, and how they move through the premises. In some cases, they've managed to reduce the workload by spreading it over a longer period of time, or reducing the throughput by spreading it over a longer period of time. That may not be possible, but these are ways that some of the premises have been looking at doing it. They've also tried to limit movement around the premises and to increase the distance between the workers. So those are sort of structural ways and management ways that they've tried to look at reducing the risk of bringing people on. They've also... Is there a question?
No, sorry, okay. Go ahead.
Okay, I'll carry on. I'm sure there's plenty of time at the end for lots of questions and discussions, and I'm sure there'll be a lot. So maybe if I just plow on then. Also, many of the premises have developed rules, maybe many, as our colleague from Metro was saying, how the staff are trained and what they must do and what they must not do. Obviously covering the mouth, sneezing and coughing and washing hands afterwards, disposable tissues and disposing of those hygienically, prohibitions on spitting. Nobody's allowed to spit. And I would add prohibitions on shouting if possible, although I'm not sure how you're going to make yourself heard in many of the premises. But, you know, trying to modulate your voice so that it's not actually spraying out the virus if you happen to be positive. Ideally, people should wear masks all the time. And, you know, there's a lot of information on what are the ideal standards for masks, but the general feeling is that any kind of face covering is going to help mitigate the spread of the virus. If those masks are disposable, they need to be disposed of safely, and there needs to be an adequate supply, enough for visitors if you do have to have them, as well as the operatives, and they need to be disposed of and changed frequently. If they're reusable, there's the issue about laundering. The research that demonstrates the survival of the virus on cloth is really quite important because it highlights the importance of changing the PPE and the overclothing at the end of each shift and washing them correctly. One of the main issues about limiting the spread of the virus is the same control that we use in every other infectious disease. It's about effective hand washing. And the WHO has advice on how hand washing should be carried out. And for many people, I think this is the focus of their training, about washing hands with soap and water for at least 20 seconds. I mean, 20 seconds is a long time. When I'm training my students, I make them sit quietly for 20 seconds so they can see just how long that actually is. And it is a long time to be washing your hands. And the advice is that washing with hot soap and water and rinsing, and then using an alcohol-based sanitizer after the hand washing is very, very useful in trying to control the spread of the virus from these pre-symptomatic and asymptomatic carriers. And there are standards that have been published and accepted on what sort of sanitizers work best. And I've put some information there. Obviously, the ethanol based sanitizers, minimum of 70% is usually desirable, but the quaternary ammonium compounds, which are good disinfectants, can also work very well in this context. So there is advice out there about effective hand washing, and it is reasonably easy to access. Effective hand washing is important, but so is extensive hand washing. So it's no good effectively washing your hands once and then not doing it for the rest of the day. And again, this is sort of adapted, this list is adapted from the WHO and from a lot of other guidance that's available, including some guidance from the government that Michele got from Italy and translated, and from our own guidance from this government, and from the WHO, as I said. And that list, you can see of when you should wash your hands. The operatives have got to be encouraged to wash their hands at all opportunities. Now, this means, of course, that you've got to have sufficient hand washing stations and sufficient equipment, soap, sanitizer, and so on, for the operatives to be able to wash their hands at all those opportunities. So control of the virus through good personal hygiene is a really, really important control. And I think most people would agree it's not just COVID-19 that's controlled that way, it's all the other foodborne illnesses as well. The premises and equipment also have some controls that can be attended to. And Gabor and Omar assure me that here again in Pakistan, you have an advantage over those of us in Europe with regard to the ventilation, certainly of the slaughterhouses. Good ventilation is really important as a control, because what you're doing is sorting out, ventilating the place. You're blowing the virus out of the area, but also you're reducing the concentration of it per titer of air. And so the ventilation of a premises is really important. If you bear in mind the evidence that I presented earlier, where it can be surviving for at least 16 hours in an aerosol in the air of a food business. The other controls regard thorough cleaning. So again, it's good hygiene practice. I mentioned the survival is best on stainless steel and plastic. And so really the thorough cleaning of all surfaces and equipment, at least at the end of the shift, but in many cases more often, during the shift. It can survive on wood for up to 2 days as well. And so I know that's prohibited in most of the food businesses, in meat businesses in Pakistan, but it can actually survive on there, and there will be wood around the premises, pallets and things like that. So attention should be given to that. And when we say thorough cleaning of the surfaces and equipment, that means thorough washing with hot soapy water and then rinsing before there's a disinfection stage. And I think it's important to emphasize what the disinfectants should be. If you're disinfecting things like knives, there's a standard procedure in the meat industry to use hot water, but it does have to be above 80 degrees to be able to disinfect. Now that will destroy COVID-19. The virus doesn't survive at high temperatures. But if you can't use hot water, or your fixed equipment and you wash them down and you need to disinfect them, one of the best disinfectants is actually bleach. A lot of places it's not terribly popular, partly for the health and safety reasons, because it is very corrosive. But bleach is a very, very effective disinfectant against many microbes, and certainly against COVID-19. And it doesn't have to be a terribly strong concentration. However, if you're using bleach as a disinfectant, it's absolutely essential that the equipment and the surfaces are cleaned and rinsed before using the bleach, because bleach is actually inactivated by organic material and also by detergents. So if you don't clean and rinse first, then you're actually inactivating the bleach and it's not going to have any disinfectant effect. If you look in the guidance that's published, there are a variety of other chemical disinfectants that can be used. I mean, we mentioned hand sanitizers that have got 70% ethanol in them. That can also be used to disinfect surfaces and equipment, but is really not suitable for widespread use or for large equipment. It's typically used for things like probe thermometers and small pieces of equipment. But the quaternary ammonium compounds and other commercial disinfectants have been demonstrated to be effective. And again, those are available commercially, and I've put a couple down there that are recommended by the Italian guidance. So these sorts of controls are really very widely accepted, and they're not too different from the normal good hygiene practices that you would recommend to control normal infectious diseases in the meat industry or in other food businesses. If I was going to inspect these premises, I would have myself a COVID checklist, which the inspectors could use, and also that the food businesses could use, to sort of work through and have a look at whether all of the aspects of control had been addressed and identified with regard to controls of COVID. For example, how are people controlled and screened? What's the infectious disease policy? How do people contact the owner or the manager or the supervisor to report that they're sick? Because if they've got symptoms, you don't want them coming onto campus, the premises. Do you have a sort of electronic way or by telephone that people can contact you? How are they screened? What do you do about visitors? So I'd be asking that in the first instance when I was inspecting. I would also be asking how staff are trained, and following up on Gabor's comment with regard to Metro, how do you train your staff to control the COVID spread? What sort of posters do you use? What sort of training mechanisms do you use? How do you check that they know what they're supposed to be doing? I said hand washing was one of the most important ones, but are there sufficient hand washing facilities, and are your staff using them appropriately, and how do you know? Have you increased the amount of sanitizer that you have available? Have you increased the amount of soap? Things like that I would be checking as an inspector. Obviously, I would be checking about the PPE. Are people wearing masks? And more importantly, how are they using them? How are they disposing of them? How do we know that they're doing their job? What about the overclothing? How is that being cleaned? When is it being changed? If it's disposable, is it being disposed of correctly? And of course, I would be looking into the cleaning schedules. How are the premises and the equipment cleaned? What disinfectants are they using? And do people know how to use them? And I think that's a really important thing to ask, because some research we did here in Birmingham many years ago, in 2000 and 2001, with the butchers here, it wasn't just the butchers and their operatives who didn't understand how to use the disinfectants very well. A lot of the inspectors didn't understand it either. They didn't really understand about the inactivation of disinfectants if you didn't thoroughly rinse down before using them. So that's a big area that I would be checking as an inspector. And maybe this isn't as important in Pakistan, but here in the UK, we would certainly be looking at how they ventilate the premises to try and clear out any of the problems that might occur from asymptomatic or pre-symptomatic operatives. So that was really just a list of what the literature says, what is the sort of agreed good practice that's been published with regard to trying to control COVID, and particularly in light of the number of very large outbreaks we've had to manage in the meat industry. And I would add, it's not just the meat industry, but the seafood industry as well. I don't think it's a coincidence that the index case and the index outbreak was in a seafood market in Wuhan, because the seafood markets that I've inspected have been very, very similar in those critical aspects. They're noisy, they're cold, and they're damp, and people walk around them a lot. And so they have very similar characteristics to certain parts of the meat industry. And it's for those reasons that we're seeing these very large outbreaks in these types of premises. So just to summarize, COVID-19 is not considered to be a foodborne illness, but slaughterhouses and meat factories in particular can be centers for extensive outbreaks. And that's because the environment in these premises, and the slaughterhouses and meat premises, can enhance the spread of the virus if an infected person comes onto site. So if you get a single infected person coming onto the premises, what you actually do is to create an environment where you can get this super spreading. And so many, many, many people will become infected in that environment. And the environment that allows this super spreader event is the close proximity of the workers, the noisy environment, which encourages people to shout, and the high humidity. In the UK and in the States and in Europe, it's also the temperature. It's very, very cold in most slaughterhouses and in most meat premises. And all of those things encourage the person-to-person spread and enhance the survival of the virus. Also, the infrastructure of the premises, we have an emphasis on metal surfaces and plastic surfaces, and these two types of surface have been shown to prolong the survival of the virus if they're contaminated by an infected person. And that makes the thorough cleaning on a regular basis absolutely essential to control the virus if it does come into the premises. I've listed some references that I've used to put this presentation together. It may interest some of the other experts on the working group. If you need a review article for any purpose, the one that I would definitely recommend, that I found very helpful and very well written and very easy to read, is number 3. It's the Kingsbury and Lake review article, and that was done for the New Zealand Food Safety Science and Research Centre. And it's a really good summary. It was published in July. It's a really good summary with a very excellent reference list if anybody wants to look at that. And I'll make these all available if you'd like me to for them. So that was just a sort of summary of what is published in the literature, what the sort of standard procedures are. And I think if everyone's agreeable, I'd like to throw the floor open to comments and questions, so we can perhaps have some discussion as to how useful or valuable some of these suggestions are.